Hi, I'm Dr. Bonnie Boles. I'm the Chief Medical Information Officer for Tanner Health System, but I'm going to talk to you today not as the Chief Medical Information Officer, but as a pulmonary critical care physician who's been called back to the bedside to help care for critically ill COVID patients in the ICU. I'll talk about why I was vaccinated. To be quite honest, I was vaccinated because I'm more afraid of what this virus could do to me than I am afraid of a vaccination. And I believe the science. The science shows that the vaccinations are safe and effective. And we are seeing that bear out in the statistics by looking at vaccinated people who get infected have far less severe infections and are sick for a lesser amount of time, 2 to 3 days. Less than 2% of vaccinated people who get COVID are requiring hospitalization. And fully vaccinated patients represent far less than 1% of the total COVID deaths in the United States. And I got vaccinated because I'm setting an example, not only for my community, but for my coworkers and everyone that I can talk to about vaccination. And I don't want to be a burden to the healthcare system. The COVID patients are using so many resources, not just at Tanner, but throughout the country, that if your loved one has a heart attack or has some car accident or trauma, it's very possible that they would have a delay in getting care anywhere in the state or the nation. We have 95 between our two hospitals that are hospitalized currently with COVID, and the average age has gone down with this Delta variant to 56. 56 years old is the average age, and we're seeing again younger patients with fewer medical issues. So every day we have exhausted caregivers on the front lines who are emotionally and physically spent, to be honest, for doing this over the last year and a half. The vaccine is our best hope at getting our lives back and slowing down the spread of this virus. We know a lot of people have concerns and are hesitant, but just looking at the statistics again about how few deaths we have in fully vaccinated people and how fewer days of illness the vaccinated people have. I mean, this virus is wrecking people's lives. And we are your healthcare system in your community. We would never advocate for something that we didn't think was in the best interest of our community. We know that there have been about 360 million vaccinations given in the U.S. alone. These vaccinations are safe, they are effective, they are preventing prolonged illness, they are preventing deaths, and they're really our best hope at getting our lives back. There's another reason I wish people would consider getting vaccinated. You know, the vaccine was approved under an emergency use authorization by the FDA. And it's funny because all the people that are in the hospital that are unvaccinated because they were worried about that emergency use authorization are all getting drugs to treat COVID. Every single one of them is under emergency use authorization. And isn't that ironic? You won't get a vaccine that may save your life or keep you out of the hospital, but you get admitted to the hospital and you get sick with COVID and you get drugs to treat you and make you better, we hope, that are all under emergency use authorization. So that's another thing to consider when you're trying to decide what you're going to do.